Welcome back to my channel. This is Lex and this is part 2 of my US Immigrant Visa Application series.
Those doors, I'm a fool for your love.
Hello there once again. Today we will be talking about my nerve-wracking experience in St. Luke's Extension Clinic or SLEC for my required medical examination for my US Immigrant Visa Application. Last time we talked about the things that you should bring to your US Embassy interview, and one of the requirements is the medical exam. So here we will learn what happens during that medical examination. Let us first understand why we Filipinos applying for immigrant visas need to have this medical exam, or what is the legal basis for requesting medical information from visa applicants like us. Well, medical eligibility is a requirement of the Immigration and Nationality Act or INA. It is a US immigration policy that we need to follow just like any other law. Failure to provide required information may cause delay or denial of your immigrant visas. While I was waiting for my number to be called, a lot of people in the clinic were asking, why do we need to undergo this examination? So, what for? To clarify, the medical examination is not a complete physical examination like the ones conducted in hospitals to check on your health status and in the end get some prescription medicines if they found something wrong if they found something wrong in your body. Its purpose is to screen for certain medical conditions relevant to US immigration law. The panel of physicians is not required to examine you for any conditions except those the US Public Health Service specifies for US immigration purposes, nor is the physician required to provide you with the diagnosis or treatment even though other matters related to your health might be discovered. So hindi siya check-up ng doktor. So this examination is not a substitute for a full physical examination, consultation, diagnosis, or treatment by your primary healthcare provider. Immigrant visa applicants must complete their medical examinations with authorized physicians before their scheduled interview dates. If you complete your medical examination after your visa interview, processing of your immigrant visa case will be delayed until the US Embassy or Consulate has received your medical examination results. So therefore, applicants are strongly encouraged to complete their medical exams prior to their visa interview. So before your visa interview. In the Philippines, St. Luke's Medical Extension Clinic or SLEC is an authorized partner of the US Embassy in our country. It is located at 1177 George Bocobo Street, Ermita, Manila. Well, the clinic is near Robinson's Place, Ermita. And take note, this is important, medical examinations performed by non-authorized physicians will not be accepted. So hindi pwede yung mga clinic kung saan-saan. Only St. Luke's can issue you medical certificates. I made this video to basically simplify the steps and to ease your anxiety. I was actually stressed to have this examination because, I don't know, they might find something that would delay the issuance of my immigrant visa, right? I know a lot of you are thinking about, what if I have pulmonary tuberculosis or TB? So halos lahat ng Pilipino mayroong TB, no? So nagpo-positive sa test na yan. Well, in this video, I have 4 simple steps that you can follow when you're scheduling your appointment in St. Luke's. As a little disclaimer, this is not official. SLEC or SLEC, nakakabulol. SLEC has their own system on how things will go for you when you have your medical exam. So first step is to register online at www.slec.ph/us/registration. I'll link the link. So I'll link the website in the description later. You will be asked to fill in information about the following to make sure you enter the correct data that is asked of you. So first is your case information, second is your applicant details, correct contact information, correct passport information, and some additional questions and some of your petitioner's information. I would just like to put emphasis on the following information here that you will enter. Make sure, check twice that the details you enter are correct. And after filling up the necessary information on the online form, just click submit. You will receive a confirmation email that your pre-registration for the US Visa medical examination was received and accepted. Print the form and put it in your document folder, which you will bring on the day of your clinic visit. Now that you have your scheduled appointment, it's time to actually go to your examination or your medical examination. Make sure you have the following. Number 1, the interview letter from the National Visa Center. So that's the first document that you have in your document folder. Okay? Then appointment confirmation from the embassy or appointment confirmation from the call center. So if you are the principal applicant, make sure you have two copies. So one original, one photocopy, or just print 2 copies. Okay? And then valid passport and 1 photocopy of the biographic page. I believe I've mentioned that on my first video. And then 4 pieces 2x2 visa photos. Just make sure all the 4 photos are identical and malinis. So sometimes, because they will be asking you to write your full name at the back of your photo, and then diba susulat tayo, and then pagpapatong-patungin na natin siya immediately. So yung ink nagsismudge dun sa actual photo. So pag chinek yun ng guard, ay madumi yung picture mo. So uulitin niyo yung picture. So yeah, make sure tuyo na malinis yung photo na ibibigay niyo sa guards. Okay? So the 3 photos will be submitted to the US Embassy, and the remaining photo will be for your medical file. Okay? Then 1 copy of your online registration confirmation form. This is your this is the document that you have printed after filling up information in SLEC website. Okay? Also, whenever applicable, you can bring old chest x-ray films taken 3 months prior to the medical examination, or immunization record. Yung ano ba yung immunization record, yung mga bakuna nyo, mga vaccines. So just make sure you have the proper documentation of those vaccinations, okay? Because reported vaccines will not be honored. So hindi pwede yung, ay na-injection na po ako ng ganyan, ay na-injection na po ako dito ng ganito. But where is your proof? So make sure you have the records of those vaccinations, okay? They say immigrating to the US is not cheap. Well, I totally agree. At present, St. Luke's Medical Center Extension Clinic, the embassy's accredited panel of physicians, charges 17,025 pesos for the medical examination of adult immigrant visa applicants ages 15 and above. So it is really, really expensive. So at the cashier, I asked the personnel for a breakdown. Sadly, they're not allowed to issue a breakdown of the laboratory test and the prices. Well, I did not argue anymore. Baka i-report ako na, eto, tanong to ng tanong, cancel niyo yung visa niyan. So, hindi na ako nag-argue pa. So, just paid in cash. So, basically, cash lang tinitake nila, bawal ang credit card ata. But I'm not sure. At that moment, that was my thinking. Just follow the policies and I will be okay. So, the medical examination is conducted for 2 days. Day 1 is intended for registration, laboratory tests, and physical examination. Then Day 2 is intended for immunization should the findings in Day 1 requires you to have immunization. Well, Day 1 is actually stressful. So the medical examination includes a review of applicants or my medical history, physical examination, chest x-ray, blood and urine tests. The physical examination will at least include examination of your eyes, ears, nose, throat, extremities, heart, lungs, abdomen, lymph nodes, skin, and external genitalia. Well, during this test, expect to sign consent forms, okay? So for a quick recap of my day 1, I arrived 8 o'clock in the morning. So blogs related to this post suggest that you should be there before the opening. So yung iba 4 a.m., iba 5 a.m. because mahaba ang pila. Well, verification area opens at 6 a.m. So they recommend you should be there nga 5 a.m. or 4 a.m. Well, your choice actually. First come, first serve basis naman, and I'm not a morning person, so late ako. So 8 ako dumating. So what actually happened on my first day? Ay na naman, nag-burp na naman ako. So what actually happened on my first day? First, there will be a verification of the US Embassy packet by the SLEC guards. So sa the ground floor yon, and they will check your documents, and once complete, they will issue you a number and you will be ushered to the ground floor for registration area or to the registration area. So mine was 228. I think meron akong picture. 228, and that's how long the line was on my first day. Since I have my PDS already, or the patient data sheet from my online registration or online pre-registration, I submitted it to the reception area for encoding, digital picture taking, and fingerprinting. Okay? It took me about 40 minutes before my number was called. Then after that, you go to the second floor for payment of your examination fee. So it took me another 20 minutes. Sobrang haba nung pila, okay? After receiving my receipt, I immediately went to the radiology department for my chest x-ray. This part is really the most stressful for me. Knowing that I've worked as a clinical instructor in the emergency room and intensive care units when I was a teacher, who knows, I might contracted pulmonary tuberculosis. A funny thing is that I heard people talking about how many sterilized milks yung ininom nila bago magpa-exam. So, bago magpa-x-ray. So, well, people, this does nothing to do with your chest x-ray results, okay? So, stop doing that. Well, I suggest wear something very, very comfortable. Wear comfortable clothing which you can remove and put back on easily. For guys like me, t-shirt or polo shirt is highly recommended. For girls, I don't know, ano bang tawag doon? Wear yung mga one piece skirt, tapos ano ba? So for girls, yung madaling tanggalin, avoid wearing, what do you call this, skinny jeans, kasi ang hirap nun tanggalin, I believe, okay? After my x-ray, I went to the laboratory department for my blood and urine tests. If you're afraid of needles like me, well, good luck. Please listen to the medical technologists for instructions, especially on how to properly collect your urine samples. So, yes, in here, another 40 minutes. Then I went up to the USA counter for my vital signs taking. I've waited about 50 minutes for them just to take my blood pressure. So, wala pang ang temperature, so incomplete yung vital signs, pero siguro yun lang yung kailangan nila. And then another 15 minutes for my eye exam, so magbabasa kayo sa Snellen chart, okay? Then another long way for God knows how long. So kailangan patience dito, okay? Make sure full battery kayo, and meron kayong battery, meron kayong power bank, so you can play your YouTube, you can play games, okay, while waiting. Food is not allowed inside. So, mas maganda, busog kayo, meron kayong heavy breakfast, okay? And then after that, I went out for a quick bite and returned about 1:45 p.m. So, and then I'm back in line for the last procedure for the day, which is the physical examination and immunization interview. Waiting time here is about 25 minutes to 30 minutes. So ayun, I went inside the physician's office, then undressed myself, leaving just my underwear and put on the gown. So they provide you with fresh gown naman, hindi naman yung reuse na gown ng ibang naunang applicants, okay? So don't feel violated, it's a routine procedure. And if you're wondering if the doctor examined my private parts or genitalia. Nope, he didn't. He didn't. Immediately after the physical exam, I put back on my clothes and go. And there goes the physician interview. Then I was asked to proceed at the immunization area. I think it's at the second floor. Okay, to be interviewed by another physician about my immunization history. So another 25 minutes, okay? After all the exams, my records were submitted to the checkout counter. I was advised to return the following day or yung day 2 for the actual immunization. For day 1, I believe I finished about around 5:30 in the afternoon. So sobrang long day for me. And then day 2 arrived, okay? It's more relaxed, so need not report too early, for they will give you a specific time when you should return for your immunization. So I was scheduled around 2:30 in the afternoon. So I decided to window shop at Robinson's Place before going to my appointment. So I arrived on time. I believe I arrived at 2 p.m. and it's the worst decision ever. Bakit? Ang haba na nung pila. So it took me 3 hours before my name to be called for immunization. So I suggest go there 1 hour before because uunahan na naman kayo ng mga kababayan nating mahilig pumila na maaga. Okay? So after all the 3 hours waiting time for my immunization, add another 1 hour for the releasing of your medical results. Okay? Mine was released 6 p.m. Kaloka. Okay, but the good thing is, I went home with the document that I needed for my US Immigrant Visa Application. So, this is very, very important. St. Luke's actually gives you the results of your medical examination and in a sealed brown envelope. Never, ever, open the envelope. Do not be stupid and be curious of what the contents of the envelope, okay? You're supposed to bring that with you completely sealed together with other documents required for your US Immigrant Visa interview in the embassy. Ayan. Ito. So, they will give you a CD. You gotta keep that, put it in your document folder. And make sure you also keep your immunization record and scan it and produce a soft copy. So, actually sa checkout counter or sa releasing counter, they will ask you to take a photo of this document. Your immunization record. So, ako in-scan ko na lang siya. Well, I have the original naman, then I have a scanned copy, then in-email ko na siya. So, just in case mawala ko siya, I have the immunization record. And then nakalagay dito.
Do not lose this US Department of State form. So this is a personal copy of your vaccination record, US Department of State form 3025, which you will be required to present upon change of status, enrollment in school, and application for work in the US.
So further vaccinations are recommended as required. So more pa. So ayun. Just make sure you keep this immunization record. That's very, very important. So that concludes my experience at St. Luke's Medical Center Extension Clinic for my medical exam requirement for my US Immigrant Visa interview in the US Embassy. If you find this a little helpful, please don't forget to like the video. And if you haven't subscribed yet, well, now is the perfect time. So thanks for watching and see you next time on my US Immigrant Visa interview video.